So this is the overview of the skeletal system. We are going to go over the bones of the body. We have our little handy dandy skeleton. We're actually going to start from the top of the skull. These are the two parietal bones, and then you also have the frontal bone, as well as the occipital bone. Now, there are definitely a bunch of landmarks that we can see, not necessarily on the model here, but the big ones that we can see are like the zygomatic process, the mandible, which is the jawbone, the maxilla, the nasal bones on each side. You have the bones of the teeth as well here. You have the mastoid process, which is pretty prominent here. And then we also have the occipital protuberance. These are some of the big landmarks on the bones of the skull. From there, we'll go to the thoracic region of the skull. This is still considered the axial skull, or the axial skeleton. Anywhere from the head to the pelvis is considered the axial skeleton. And within the axial skeleton, you have the clavicle bones. Most people know this as the collarbone. You have the manubrium, the sternum, and the xiphoid process coming off the bottom of the sternum. Then we have our ribs, and then down here are our false ribs, the two ones that feel that they're not attached. Within the rib cage, you can also kind of see into the back where you see the scapula. This has a couple different processes, the coracoid process and the acromion process. The acromion process is actually the process that joins the clavicle and the scapula, making the shoulder girdle. And going from the back, we have our atlas and access bones. Those are C1 and C2. Then we go down to the cervical spine has 7, so including access and atlas, there are 7 bones. 1, 2, 3, 4, 5, 6, 7. That ends right about there. Then you get into the thoracic spine, which has 12, and then from advancing down the thoracic spine, you have the lumbar, which is the 5 bottom spinal bones that have the protrusions. The fused bones are the sacrum, and at the very tail of it, are considered our tailbone is the coccyx. Then from there we get to the pelvic girdle, which is the ilium, the ischium back here, and the pubic bone up here. The pelvic girdle holds pretty much everything, intestines and bladder and that kind of organs, so it's nice to have a bowl shape. And then from the axial skeleton, we get into the appendicular skeleton. The long bones make up a majority of the axial skeleton, or the appendicular skeleton. So from the top, we have the humerus and the radius right here on the outside, and the ulna on the inside. From there, we have the carpals. They aren't very defined within the skeletal model that we were given. Then we have our metacarpals right here. I'll show you on the back side. And then we have our phalanges, and then which are divided even further into phalanx. And that's obviously on both sides. From there, we'll go to the bottom portion of the axial, or the appendicular skeleton, where we have the femur. Some pretty big landmarks on the femur, obviously, is the femoral head and the femoral neck, and then the shaft of the femur, also called the diaphysis. The patella right here, most commonly referred to as the kneecap, and the tibia, which is the big bone in the shin, and the fibula, which is the outer. The tibia is the weight-bearing bone. From there, we go to the foot, where we have the calcaneus, and then the talus. The talus is the bone that articulates with the fibula and tibia. The calcaneus is what we consider the heel. Then we have our metatarsals, or well, our tarsals, and then our metatarsals right here. Then we have the phalanges of the foot. It's obviously the same on both sides, unless born with abnormalities. The classification of bones is obviously the long bones, like I was saying. They are long in shape. They have diaphyses and epiphyses. The short bones are mostly common, found in the tarsals and the metatarsals. Or not the metatarsals, but the tarsals and the carpals, as well as some of the bones of the face, dental bones. Those are considered small or short bones, and then from there we have flat bones, which make a portion of the skull are mainly flat bones. So your frontal, parietal, temporal, and occipital bones are considered flat bones, as well as your scapula. That's considered a flat bone. The next one are irregular bones, such as the spinal column. They are not fitting with any shape, long, short, or flat, so they are considered irregular bones. Another short bone is the patella as well. We have shown you the cranial bones, so there is a easy clinical application to this as a PA. Obviously, you're going to see broken bones if you work in the ER. So just knowing the anatomy of the bones and which bone articulates with which, you will be able to figure out what to look for if you do have a broken bone. Obviously, you obviously need to know a bunch about the skeleton to make sure that everything is working, that there's no broken bones in the ribs, and there are no broken bones in the arms. X-rays are a great tool that they use to identify these broken bones. Even if they are a hairline fracture, they can still cause a lot of pain.